So today we're going to talk about a really dangerous injury that, more often than not, goes completely unseen after major physical trauma. It's a kind of silent threat that can pop up hours, sometimes even days after an accident, which makes it one of the most deceptive dangers in emergency medicine. Just picture the moments right after a serious impact. A car crash, a nasty fall, maybe a big collision playing sports. Your adrenaline is just coursing through you. You're checking for the obvious stuff, right? Broken bones, cuts, anything that looks, well, damaged. But what if the most serious injury isn't on the surface at all? What if it's quietly developing deep inside your chest, even if your ribs feel fine, even if there isn't a scratch on you? Well, that hidden danger has a name: pulmonary contusion. And it's basically a deep bruise to the lung tissue itself. And let me tell you, it's way more common and way more serious than most people think. And when I say common, I mean it. In cases of blunt chest trauma, pulmonary contusions are actually the most frequently identified lung injury. We're talking up to 75% of patients. That makes it a huge and often overlooked complication. So what is actually happening inside the body when a lung gets bruised like this? To really get a handle on the danger, we've got to look at the anatomy of the injury itself. Okay, so a pulmonary contusion is an injury to the lung's really delicate functional tissue. Doctors call it the parenchyma. And here's the key: it doesn't involve an actual cut. Instead, the raw force of the impact damages these tiny blood vessels, causing blood and other fluids to leak right into the alveoli, those little air sacs where the all-important oxygen exchange happens. The best way to think about it is like a sponge. A healthy lung is like a dry, airy sponge, just easily soaking up oxygen. But a contused lung, it's like a waterlogged sponge. The air sacs get so full of fluid that they literally can't absorb oxygen. And that leads to impaired gas exchange and, eventually, hypoxia, which is a super dangerous state of oxygen deprivation for the whole body. And this all happens in a crazy fast cascade. First, you have the impact. That tears the fragile capillaries lining the alveoli. Immediately, blood and fluid flood those air sacs. Then the body's immune system rushes in, kicking off this massive inflammatory response that can spread and make the whole problem even worse. But wait a minute, how does all this happen without breaking the skin or even the ribs? Well, it all comes down to three pretty fascinating and destructive principles of physics. First up is what's called the spalling effect. Imagine a shockwave from the impact traveling through your body. When that wave hits the super delicate border where the air in your lungs meets the fluid in your blood vessels, the force just rips those fragile cell walls apart. Second, you've got the inertial effect. During a sudden stop, like in a car crash, different parts of your lung are moving at different speeds. The lighter, airier tissue of the alveoli literally gets torn away from the heavier, denser structures. It's almost like an internal whiplash injury for your lungs. And third, there's the implosion effect. That same pressure wave can compress tiny gas bubbles inside the lung tissue. When the pressure is released, those bubbles rapidly expand again, but with enough force to tear the delicate lung structures all around them. We're talking microscopic explosions inside your lungs. So you combine all these forces, and what do you get? You get an injury that's incredibly difficult to spot right away. And that delay, that's exactly what makes it so dangerous. And this is the critical point, the thing you have to understand. The real danger unfolds over time. Right after the trauma, a chest X-ray can look perfectly normal. But over the next 24 to 48 hours, as all that bleeding and inflammation builds up, the full extent of the injury finally shows up. And that's when symptoms like shortness of breath and chest pain appear and get worse. This is exactly why the choice of imaging is so critical. A chest X-ray is often the first step, sure, but it can miss the signs because they're delayed. A CT scan, on the other hand, is way more sensitive. It can pick up on a contusion almost immediately. And, this is really important, it can measure its volume, which is a key predictor of how severe the outcome's going to be. And the outcome can be severe. I mean, depending on the size of the contusion and any other injuries, the mortality rate ranges from 14 to a truly staggering 40%. This is not a minor bruise, it's a life-threatening condition. That number alone just highlights how urgent treatment is. But if you can't stitch it up or put a cast on it, how in the world do medical teams manage this kind of internal damage? Well, the philosophy of treatment is really the key here. See, there's no magic cure for the bruised lung tissue itself. The goal is entirely supportive. You help the body's own healing processes by managing the symptoms and preventing any further complications.
So this involves a few critical things. Number one priority is keeping oxygen levels up. Next, they have to control the pain. I mean, think about it. If it hurts too much to breathe, you're not going to take deep breaths, and that can lead to parts of the lung collapsing, a condition called atelectasis. So encouraging deep breathing and coughing is absolutely key. And the whole time, the medical team is on high alert, just watching for severe complications like pneumonia or acute respiratory distress syndrome, also known as ARDS.
Now, to help guide all of this supportive care, clinicians use scoring systems, like the one you see here. They look at key things, like a patient's oxygen levels, how much of the lung has collapsed, even how stiff or compliant the lung is, to generate a score. And that score helps them quantify just how bad the injury is and decide how aggressive they need to be with their treatments, from just simple monitoring all the way to intensive care.
All right, so after diving deep into this hidden injury, what are the most important things for you to remember?
Well, first and foremost, prevention is absolutely the best medicine. Since this whole thing is caused by blunt trauma, avoiding that trauma is the name of the game. And that means the simple stuff, using seatbelts, taking steps to prevent falls, and wearing the right protective gear for sports and at work. But honestly, the single most important lesson from all of this is this. Because the symptoms are delayed, you have to seek medical evaluation after any significant chest trauma, even if you feel perfectly okay at first. That 48-hour window is absolutely critical, and getting monitored early can be the difference between a full recovery and a fatal outcome. You know, this all leads to a much bigger question. A pulmonary contusion is a perfect example of a really serious condition just hiding in plain sight. It kind of makes you wonder, what other dangers are we missing, and how much could a little bit of awareness really change everything?